classically, lip lifts were only performed on older patients in their 60s and 70s with thin, light, white skin who could really afford to have some scarring under the nose. Now the way the lip lift has been modified, I can perform this procedure very safely and very nicely on patients in their 20s and their 30s, 40s, all ages, of all skin types, all cultures, and men and women, which is very different than before. The difference comes from the fact that it is a tension-free lift that is performed with minimal trauma to the underlying muscle now, and minimal trauma to the nose, so you can get an incision across the base of the nose that is barely visible. So there are many different types of lip lifts. There are lip lifts that go directly at the vermilion border. There are some that go from inside the nose. There are some that are just stitches. The classic type of upper lip lift is performed with a bull's horn or gull wing incision, which means it comes across the crease at the base of the nose. The way a modified upper lip lift is performed is using the same type of incision with a couple small changes, and skin is removed. However, it's not just closed up right away. Instead, now skin is released to take the tension off of it, and the sutures are no longer placed from the lip to the nose. They're placed to deeper ligaments to suspend the lip up properly, and this allows you to get much greater change in the lip and more natural change with less changes in the base of the nose and less chance for scarring. The risks classically associated with lip lifts of older types of lip lifts include scarring of the nasal base, effacement or distortion of the nasal base, widening of the nose, disproportion of the lip, and overall just need for revisions for multiple reasons. With the newer type of modified upper lip lift, the chance of any of those things happening is exceedingly low. So mainly the only thing people have to worry about is the healing time. It has a little bit of a longer healing time than classic lip lifts do, but that healing time does ensure that the lip heals better because the lip is a little bit swollen, it moves less, and the scarring tends to be less because of that. The only treatment ever needed afterwards is a couple lasers, possibly across the base of the nose, just to help diminish the scar that's already difficult to see. The lip lift itself takes about 45 minutes to do. Stitches stay in for about 7 days. It takes about 3 months to really see the final result, and the reason is with the modified upper lip lift there's more movement done in the lip, and because of that it doesn't drain so well the first couple months, so people are a little bit swollen, lumpy, and bumpy. By the 3rd month everything tends to smooth out and it looks awesome. That's when I tell people they're ready to go to weddings and big events like that. The change in self-esteem that I've seen from lip lifts is huge. It is similar to a nose job actually, in the way that one tiny part of the face can make a huge difference. It's very central, and it's something that if long or if over projected from fillers or with other problems, it makes people look older. It makes them look like their lip is incompetent, and it just loses sensuality for most people. When you do the lip lift, they immediately gain increased sensuality, sexuality of the mouth. They are able to smile more easily, and they just appear younger to everybody. So their confidence really shoots through the roof after doing this. Not during the healing phase, obviously, but right after that 3 months, everybody loves it.